And it's a big struggle to diagnose these patients because they present with such subtle symptoms. There are about 30 types of amyloid. In the US, the two major types are called transthyretin, which can be acquired or it's a hereditary mutation. And the other type is light chain amyloid, and I treat both of these types of amyloidosis. They both can affect the heart, and when the heart is affected, the prognosis is very, very poor. It's not as rare as we think. Amyloid, although it's not a well-recognized disease, in patients over 80 who have passed away, about 25% of them will have amyloid on autopsy, even though they had no idea they had it. And in patients who are undergoing surgeries, for instance, for spinal stenosis or carpal tunnel syndrome, amyloidosis is found in about 25% of tissues from these patients. So it's quite common if you think about it, but underdiagnosed. The only way to diagnose this disease really is through tissue. So you need tissue to diagnose it. You can't diagnose it any other way. Sometimes you can get around it with very good imaging, but in light chain amyloidosis, for instance, you need a tissue biopsy with special stains that are going to find these misfolded proteins. And my job is to get the diagnosis and treat patients right away. So I give stem cell transplants to patients. These are aggressive therapies, big doses of chemotherapy. Patients are admitted to the hospital, and they really take a risk to get rid of this disease because these are risky procedures. And the hope is that we halt the progression of the disease. We stop the production of this misfolded protein. We stop the deposition, and we save lives. That's the goal. So it's very well known that amyloid is a wolf in sheep's clothing. It is very subtle, like I mentioned before. So a typical patient, I'll give you an example. A 65-year-old patient who's previously active might start to notice a little shortness of breath when they're climbing the stairs, and they don't really think much of it. Oh, I'm getting old. Oh, I stopped going to the gym. I'm out of shape. They go to their family doctor. They tell their family doctor about these symptoms. The family doctor agrees. Yes, we're not as young as we used to be, and that's how usually it starts. And then as time goes on, the patient starts to notice other little signs and symptoms. They go to physicians, and physicians brush it off because it mimics other diseases. And by the time they come to me, they have very, very advanced disease, very, very advanced organ dysfunction, and patients have seen on average about 5 or 6 doctors before they get to me. And by the time they're diagnosed, a lot of the time, it's too late to improve organ function, and about 30% of patients will die in the first year that they see me. So it's a very dangerous disease, and it has to be recognized very early on. Even when you're thinking about the disease and you're looking for the disease, it can be hard to diagnose. So I had a patient who would come to me with several symptoms, and I said, I know you have amyloid, I know it. Everything's pointing to amyloid. And like I said, you have to biopsy it to diagnose it. And I biopsied so many sites, and everything came back negative. And I said to her, let's repeat the biopsy. We repeated the biopsy 6 months later, everything came back negative. 6 months later, we re-biopsied, and finally we found the amyloid, and we started treatment. But by that time, her organs were already pretty far gone, but we did save her life. We did give her a stem cell transplant. She's doing well today. But it can be very, very, very difficult to diagnose, even when you're looking for it, even when you know it's there. And as I mentioned, a lot of patients walking through the door have very advanced disease, and it's very difficult sometimes to reverse the damage that's been done. And that's why a lot of my research now is in early screening and trying to find the diagnosis very early on. So how are we doing that? We are sequencing genes that we know predispose patients to developing amyloidosis. We have a clinical trial right now where we've been screening patients by DNA sequencing, and we found 2 patients who had positive genetic sequences that predisposed them to amyloid, and then we looked for the amyloid, and we found very, very early amyloid, and we started them on treatment right away. So that was really amazing. We're also screening patients who are getting spinal stenosis surgeries. We're sending their tissue off for amyloid testing, and if it comes back positive, we're screening them for heart or nerve damage and treating them early on. So we're doing a lot to try and catch this disease early, because we know if we leave it too long, it'll take over systemically, and patients don't do well. And the other thing we're very grateful for is to have a lot of advocacy, because people just don't recognize the disease. Patients feel very isolated once you give them the diagnosis. Even spouses can get very frustrated with their significant other. I've seen that where marriages have been hurt from this disorder, this disease, because the spouse is just frustrated. Why can't you walk more than a block? Why can't you just get out of bed? And it's very frustrating because they look fine, but inside all their organs have been really affected. And a lot of patients also have post-traumatic stress because they've gone to lots and lots of physicians and nobody believes them. No one, people were brushing them off, and finally they have this rare disorder. Now they have mistrust in the system. They have mistrust with their physicians. So I really do thank a lot of these advocacy groups. I think a lot of the foundations that support this very rare disease, and grants that support very rare diseases, because we need the money to further research and look for a cure for this disease. Right now we're looking at not only treating the cells that make the protein, but also targeting this protein that does misfold and seeing if we can reverse the damage already done to the organs. So this is the future, is screening patients early and trying to target the actual misfolded protein. And so far we have no really